Healthcare professionals. What is a telltale sign a patient has used drugs heavily in their life? He can hit his veins better than you. When you give them 6 milligrams of Versed and 300 mcg of fentanyl and they are still talking to you like normal. Talc retinopathy. Tiny talc particles accumulate in the retinal blood vessels of IV drug users and can be seen during a routine eye exam. If they are in recovery, they will often use a lot of sugar and caffeine. If currently using, they'll spend a lot of time in the bathroom. They look 10-20 years older than their stated age. It's damn hard to get an IV in them in our usual go-to places due to scarring of the veins. They usually tell us where we have to go because that's the only place that still works. Big ass hole in the nasal septum with no other explanation for cause. I had a patient once refuse the contrast dye injection as part of an MRI scan because you don't know what's in that stuff. They were there because they were having palpitations following cocaine use. Work in anesthesia. They require 5x the meds to go sleep. He was smacking his mouth like a fish out of water. Wearing a leather jacket in the middle of a hot Texas July. Admitted to coming down after smoking meth. I did residency in Phoenix. As one of our nurses frequently referred to the tooth-to-tattoo ratio as a predictor of the amount of methamphetamine use. There was a consistent inverse ratio. When they are 2,530 years old and look 50. It's usually in their charts, but if it's not, HEPC, liver failure, pancreatitis and overall health status and appearance for their age is usually a good giveaway. 10 out of 10 pain score. Every time you ask. Some erratic behavior is common too. I see a lot of CKD and diabetes in chronic users or patients in recovery after a lifetime of substance abuse. I come from an area with a lot of heroin, coke and alcohol abuse. I've rarely ever had a meth addict and rarely crack users. So this applies mainly to those drugs. They are really bad to sedate. Show strange behavior at some earlier or later point of their stay. Withdrawal. They possibly show more obvious signs of withdrawal. They don't really like it. When they get antagonized, they might try and steal meds. They mostly know perfectly fine where and how to get an IV started with them. ICU nurse speaking. When you tell patient, doctor ordered morphine and they tell you only Dilaudid works. They're wearing a Limp Bizkit shirt. 60-year-old man who had done some drugs in life but was a heavy alcoholic. Never tells DRs of his past. Quit all by age 50. Health is falling apart by age 60. Doctor does an MRI and showing him pictures explaining the results. She turned to him and asked if he had drank heavy for years. He glares at me thinking I tattled. No. Doctor shows him the extra space in his skull around his brain. Explaining his brain had shrunk from alcohol abuse. I guess you can lie about it, but can't hide it. Impatience, mood swings, shakiness, many more. Really depends on the substance though. Drugs is an umbrella term for practicality, not for physical, chemical similarity. Weed abuse, alcohol abuse, meth abuse, all very different. Put individuality on top of it and it gets harder and harder to make a judgment. Pill poppers. When they need medications for actual painful circumstances, they don't work or require high doses. To the point where there is nothing you can do. Pain tolerance very low and medication doesn't help. But to watch them sit there in pain. Addiction knows no bounds. I work as an addiction counselor in medication-assisted treatment, methadone, Suboxone, and my clients range from homeless, barely 8th grade educated people to former doctors. That said, addicts are highly impulsive, manipulative, and typically aren't the most forward-thinking people due to the nature of addiction.
If you enjoyed this video, please check out our playlists full of similar content. Epicaricast is like doom scrolling for your ears. Please like, share, and subscribe.